Hello, my name is Debbie Pesca, and in this presentation I will be going over the philosophy of practice of comprehensive medication management, which I will refer to as CMM from here on out. So the objectives of this presentation are to describe the importance of a philosophy of practice, define the tenets of CMM philosophy of practice, and then recognize the difference between philosophy of practice, ethics, and organizational mission and vision. As you recall from the previous presentation, there are three main components of CMM, but these core elements exist in any patient care practice. So whether it is nursing, medicine, dentistry, they all have a philosophy of practice, patient care process, and a practice management system. But today we're just going to focus on a philosophy of practice. So philosophy of practice is foundational for CMM because it is the basis of everything that we do. And every pharmacist, whether they are cognizant of it or not, has a philosophy of practice. And so philosophy of practice is defined as a set of professional values and beliefs that every practitioner has that guides their actions and decisions in practice. So I think that definition can be a little hard to grasp. I know it was for me initially, so I'm going to give some examples of other forms of philosophies to hopefully make it a little bit clearer. So the first is a parenting philosophy. Every parent, whether they recognize it or not, has a parenting philosophy that guides their beliefs, attitudes, and actions as a parent. And even if you are not a parent, I'm sure you can recognize different parenting philosophies in parents that you have observed. Some people may exhibit a philosophy of tough love, whereas others may be more lenient in their approach. But whatever philosophy they have, that guides their actions and decisions as a parent. For example, if I asked you how much time kids should spend on devices, there might be differing opinions. Some would say that technology is part of our world now, so why try and fight it? Whereas some may say that kids are spending too much time on technology and it's bad for their social development. And this difference of opinions stems from differences in parenting philosophies. And some have studied different parenting philosophies and are very intentional about the philosophy they have chosen. However, for most, it is just something that they have inherently developed. Another example is a teaching philosophy. All teachers have teaching philosophies that guide the way that they teach. Thinking back on your own education, I'm sure you can think of examples where different teachers that you've had different approaches to how they delivered content and how they tested their students. Similarly, you might serve as a preceptor for IPPE or APPE students, and as a preceptor, you have certain expectations of your students in terms of what you consider to be professional behavior, what you expect them to know, and how you deliver feedback. And that all stems from your teaching philosophy. So it might not be something that you have considered before, what is my teaching philosophy, but you do not necessarily have to have the title of teacher to have a teaching philosophy and apply a teaching philosophy. So now switching gears and going back to philosophy of practice, I refer to it as sort of this guiding compass, because just like a parenting philosophy and a teaching philosophy, it guides what we do in practice. And so again, just to re-emphasize that I define a philosophy of practice as a set of professional values and beliefs that every practitioner has that guides their actions and decisions in practice. Philosophy of practice is different than ethics. Ethics, like the oath of a pharmacist, generally outline standards of conduct and moral principles to guide decision-making so practitioners can recognize what is right and wrong in clinical practice. And codes of ethics are essential to ensure fair and just delivery of care. However, they are often not discipline specific. So for example, the American Pharmacists Association Code of Ethics for Pharmacists, the American Medical Association Code of Ethics, and the American Nurses Association Code of Ethics all include statements about respecting patient privacy and health information, maintaining professional competence, and upholding themselves and colleagues to the highest ethical standard. In fact, it is argued that a single ethical code could suffice for all healthcare workers. A philosophy of practice, however, is practice-specific because it establishes the purpose for the practice. Philosophy of practice can sometimes be mistaken for organizational mission, vision, and value statements. While there are a number of similarities between these statements and philosophy of practice, so for example, both describe purpose and include values that guide practice, organizational mission, vision, and value statements generally serve to guide the institution's administrative, strategic planning, and performance activities. A philosophy of practice, on the other hand, is something that every practitioner has that guides their day-to-day practice. So then what is the philosophy of practice of CMM? In an article that was published, my co-authors and I built off of the work of Zapoli, Strand, and Morley to define 5 main tenets of CMM philosophy of practice. The first one is meeting a societal need. So what is that unique role that pharmacists bring to society? And that would be reducing medication-related morbidity and mortality. And the second is assuming responsibility of optimizing medication use. So that means that CMM is delivered consistently and holistically to assure that patients are taking appropriate, effective, and safe medications and that they are taking them as intended. And this is achieved through the identification, prevention, and resolution of medication therapy problems. And then applying a consistent approach to CMM patient care process that includes collecting and analyzing relevant patient information, formulating an assessment and plan for optimizing medication use, implementing the patient care plan, and providing ongoing follow-up and monitoring. The third is embracing a patient-centered approach. And so that means providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that the patient values really guide all clinical decisions, and making sure that the patient really is at the center of everything that we do. The fourth is caring through an ongoing patient-pharmacist relationship. So that's really that partnership that exists between the patient and the pharmacist and is built on trust formed for the purpose of optimizing the patient's medication experience. And it involves relating to individuals through active listening and with understanding, respect, and warmth. And it's an ongoing relationship of trust between the patient and the pharmacist. So it doesn't occur at just one visit. It's an ongoing relationship that happens between the patient and the pharmacist. And finally, the fifth tenet is working as a collaborative member of the healthcare team. So providing high-quality team-based care to patients involves collaborating with members of the healthcare team on shared goals in and across care settings. Consistently meeting the medication-related needs of patients cannot occur without collaboration among the healthcare professionals engaged in a patient's care. Therefore, it is essential that the pharmacists demonstrate a spirit of collaboration and embrace a team-based approach to care. And so when pharmacists dedicate themselves to CMM, it is the philosophy of practice that they are devoting to uphold. Therefore, all practitioners engaged in CMM should hold the same philosophy of practice. This uniformity of philosophy is what is needed to ensure standardization of the practice in order to deliver consistent, high-quality services to all patients. In addition, a clear understanding of what guides the practice helps the practitioner to communicate the meaning and rationale for pharmacists providing CMM more articulately and effectively with patients and the care team. And without a consistent philosophy of practice, people go off doing different things, which causes confusion about what CMM is. However, my colleagues and I recently did a small study where we wanted to look at how CMM pharmacists describe their philosophy of practice. So we had a sample of 30 CMM pharmacists articulate their philosophy of practice, and only 3 of those pharmacists included all 5 tenets. And I think that this really speaks to the need for pharmacy to endorse a consistent philosophy of practice for CMM, and why I think this is an important topic and one that has not received much attention within pharmacy. Pharmacy as a profession continues to become more involved in patient care and identifying ways to optimize medication use and patient health outcomes. Therefore, as the profession evolves, we need to consider what our philosophy of practice is so that we can move forward in a consistent direction. So just a few questions for you to consider as you move forward and think about your philosophy of practice is, 1, given everything that's been covered in this presentation, how would you define your philosophy of practice? And then 2, how would you incorporate the 5 tenets in your work as a pharmacist? Thank you.